So welcome to our presentation of homelessness in LA County. This is from Emily, Greg, and Mandy. What is the definition of homelessness? It is a state that occurs when an individual or family lacks a fixed, regular, and adequate nighttime residence, such as those living in emergency shelters, transitional housing, or places not meant for habitation. Or it's an individual or family who will imminently lose their primary nighttime residence within 14 days, provided that no subsequent housing has been identified and the individual family lacks support networks or resources to obtain their housing. Or it's an unaccompanied youth under 25 years of age or families with children and youth who qualify under other federal statutes. Or it's an individual or family fleeing or attempting to flee domestic violence, has no other residence, and lacks the resources or support networks to obtain other permanent housing. In Los Angeles, on any given night, according to the latest Services Authority's report, 75,518 people are experiencing homelessness. This is in LA County. This continues a steady growth trend of people experiencing homelessness in the annual point in time count. A continuing concern still reflected in the 2023 count is the percentage of homeless persons who are Black African American. This group represents 32% of homeless individuals in LA County as compared to only 8% of the population in LA County overall.
So now we will move on to the point in time breakdown stats. The numbers obviously cannot be exact, but it's a good estimate. So looking at the data here, you can see that people of color are most affected as opposed to white people. We can see that the majority are men. Okay, and we can see here that the biggest age affected is 25 to 54. See that we have the homeless due to fleeing domestic violence, and those numbers have also increasingly gone up since 2018 to 2022.
Okay, efforts, services, and advocacy. So over the last 5 years, the LAHSA, which is the Los Angeles Homeless Service Authority, and its partners have made 84,000 permanent housing placements. That's enough to fill Dodger Stadium 1.5 times. And last year alone, the rehousing system made over 21,000 placements. With emergency shelters, there's help from the federal government and the state of California through innovative shelter programs like Project Room Key and Project Home Key. And LA County saw a 12% increase in its sheltered population. So this is over 20,000 people in 2020, while LA's shelter population grew by 8.7%. This is over 13,000 people. The city of LA also saw a drop of 1.4% in the number of people experiencing unsheltered homelessness. With affordable housing initiatives, the LAHSA recognized the city of Los Angeles for its progress in creating more affordable housing in the past 5 years than the previous 30, which is a really big deal. And the projection that Proposition HHH will exceed its goal of bringing 10,000 units of affordable and permanent supportive housing online. For those of you who don't know, Proposition HHH was an initiative to issue up to $1.2 billion in bonds to finance construction of housing and facilities for the homeless population, and also having oversight and accountability there. So skills training programs. These are programs that are designed to help the unhoused get access to mental health professionals, medical doctors and dentists, addiction counselors, clothing, meals, transportation, job skills training, cell phone, and computer access. And a lot of the people helping the unhoused were once homeless themselves, and they completely understand the unique challenges that the unhoused face. It would take 3 to 4 years to end homelessness in LA if no additional people became homeless. Last year, I refer to that number. We rehoused 21,000 people, nearly 1/3 of the people experiencing homeless at any point in time. But the problem is there's more of a flow of people falling into homelessness faster than we can solve the problem. So let's talk about interdependence. Interdependence is the core principle of ecology. It refers to how different parts of the ecosystem are all interconnected. Changes to one part of the system will have ripple effects that impact other parts of the system. So homelessness, as we know, is a complex problem. It's one with many unknowns, and it must be tackled through a series of interrelated initiatives. We cannot solve complex problems by solving only one part. The challenges related to homelessness come from a larger system of interacting networks. So here you see the Foster, Fisher, and Watson cloverleaf, which has power, mindsets, regulation, connections, components, resources, and are all connected by interactions throughout all the systems. And these are only some of the things that are mentioned here that are important. But as you can see, there's a lot that goes into play that makes these problems very difficult to solve. Affordable housing as an illustration of interdependence. So with regulations, it's difficult to build affordable housing in Los Angeles because developers can make significantly more money renting units out at the market rate. And the city incentives that the city of LA are offering to developers are not enough to excite them to build more. From 2010 to 2019, LA lost 111,000 affordable homes. With mindset, most taxpayers and voters do not want affordable housing or unhoused pods in their neighborhood because they think it brings in crime, drug abuse, and people with mental health issues into the neighborhood, making it less safe. As a result, with power, you've got local and state politicians that worry they'll be voted out of office should they approve zoning for affordable housing or unhoused pods in their local cities. So they're slow to enact change. And then with resources, we're relying on private developers who are influenced by money and not public service. And then looking at the components, to qualify for affordable housing units, tenants must demonstrate an annual income of $41,700 or less to qualify. And an affordable one-bedroom apartment typically goes for $1,500 a month. So after taxes, you're looking at 60% of your income going towards rent, which doesn't leave much for food, health insurance, transportation, and everything else necessary to survive.
So healthcare can be an illustration of adaptation, at least the way that people experiencing homelessness can access healthcare. So when you're homeless, you have more health problems. That's just a given fact. In fact, people who become homeless are more likely to have health problems than people who don't become homeless. And once they're homeless, they're more likely to have their health problems worsen and less likely to be able to seek care that would address these problems. The emergency room of local hospitals is the most common place for those experiencing homelessness to receive health care because no one can be turned away from the emergency room. And many emergency rooms are readily available in urban areas where a lot of people experiencing homelessness reside. But this is a huge financial burden to local hospitals and taxpayers, of course. So an adaptation that happens at the state and federal level, given all of this, is in an attempt to ease the burden on local communities, state and federal Medicaid funding increases so that hospitals have the funds to meet the needs. In fact, most of homeless inpatient healthcare is paid for through Medi-Cal in our area, the state federal insurance program for the poor, or Medicare, the government insurance program for seniors and people with disabilities. And then local communities adapt as the need continues to grow for healthcare among people experiencing homelessness. Local hospitals and nonprofits find ways to collaborate and share information with each other in order to get help for people who are living on the street and get them out of a vicious cycle for good. In fact, Sacramento, California is piloting a collaboration between 4 major health providers to improve care for those experiencing homelessness in their area by sharing data in one database, not just for patient records, but to keep individuals connected with all sorts of information in order to help end homelessness for good in Sacramento.
Example of succession is the pandemic effect on homelessness in Los Angeles. It began as a macro system event, with the microsystem individuals most affected by it. But curiously, because of a bunch of countermeasures that were taken in Los Angeles, homelessness grew less than it has during any other period. So there was a successful call for federal funding to place people in protective housing programs, reduce shelter density, conduct contact tracing for COVID, and prioritize vaccinations for homeless people. The hope was that the pandemic would have no worse impact among the homeless than among the general population, but that was not to be. Researchers from USC, UCLA, and the LA Department of Public Health tallied 256 COVID-related deaths among an estimated 52,000 people experiencing homelessness between January in 2020 and November 1st in 2021. While homelessness grew by 13%, a little less than in recent years, something experts credit to the pandemic era safety nets like rental assistance, eviction moratoria, and stimulus checks. Without those safeguards in place, researchers estimate homelessness would have grown by 23% during this time.
And then here are some prevention intervention examples. If you took our previous example of universal basic income could prevent the need for nonprofits at the local level to intercede and fill the gaps for food, clothing, and shelter for the poor and unhoused. Universal basic income could prevent the depletion of state budgets at meso level for cities. Large portions of city budgets in many Southern California cities go toward local police forces responding to calls about unhoused people living on the streets, urinating in public, and having mental health episodes in public. Cities would be able to shift state monies toward community development and housing instead. And finally, universal basic income could prevent attitudes within our larger culture at the macro level, by eliminating an economic caste system of our culture and the attitudes toward the poor and unhoused, as, for example, lazy, inhuman, or even that horrible moniker of welfare queens. Universal basic income would allow for dignity and agency for all people.
Okay, moving on to some more examples of prevention interventions. We have activities that reduce the prevalence of risk of housing crisis within communities at a meso and a macro level. In the first category of prevention, we recognize that housing crises can be reduced systemically when multiple sectors focus on the big picture goals. 1, ensuring an adequate supply of affordable housing. 2, addressing systemic racial inequities. 3, improving education and meaningful and gainful employment. 4, ensuring access to affordable childcare, legal assistance, and physical and behavioral health care. Such multi-sector strategies can have the greatest impact on preventing homelessness. And the last example is activities that target assistance to prevent housing crises that do occur from escalating further and resulting in homelessness at a meso level. Assistance helps prevent housing crises that do occur from escalating further and resulting in homelessness. In most communities, this assistance is provided through mainstream systems and or the homelessness service system. Prevention services in this category often include a combination of financial assistance, mediation with landlords, legal services, and other supports. When multiple systems provide prevention assistance, it is critical that they can be coordinated and utilizing common assessment tools to identify and assist those at the greatest risk of homelessness. And that's the last example and the end of our presentation.